Police say a father is accused of giving his 17-year-old son the gun that was used in a deadly shooting at a Kearns funeral. Afawia Mantau is charged with murder and felony discharge of a firearm. Investigators say that Mantau pulled a gun during a fight and his son took it and allegedly opened fire, killing one person and critically injuring another. Police say the teen was also shot during the struggle. He remains in critical condition as well. Mantau in jail tonight. This case remains under investigation. And also tonight, Chief Investigative Reporter Wendy Halloran taking a closer look at protocols at our hospitals after shootings like this.
Well, Heidi, the shooting prompted a large law enforcement response to keep staff and patients safe. I asked an expert what hospitals across the country are doing to prevent violence.
A show of force, snipers on the rooftop, tactical gear.
One person was killed, 2 others were shot.
Unified Police SWAT, Murray Police, Utah Transit Authority Police.
We didn't know who was the suspect at the time.
To Utah Highway Patrol and other law enforcement agencies responding to Intermountain Medical Center to assist UPD when the potential for more violence could spill over to Intermountain Medical Center.
And we didn't know if was there a suspect that was coming to the hospital.
As a result, the hospital was placed on lockdown. Unified Police Assistant Chief Justin Hoyle.
We worked in complete coordination with their security, their administration, throughout the whole process.
I asked Intermountain Medical Center about hospital safety protocol. Intermountain Medical Center spokesperson Jess Gomez issued me a statement which reads in part, when our law enforcement partners recommended added measures to ensure the safety and protection of our campus, like what happened yesterday, we're going to follow those directions. Across the country, hospitals are dealing with more violence or potential threats.
Unfortunately, there is an increasing trend of seeing more violence in healthcare. Hospitals used to be considered safe havens and nothing ever bad happened there.
Dan Yaros sits on the board of directors for the International Association for Healthcare Security and Safety, a healthcare security consultant.
It's hard to go a week or so without seeing a devastating event taking place in a hospital or in healthcare in general.
In this situation, Unified Police caught the individuals who were trying to take one person who had been shot to a hospital and took them to Intermountain Medical Center. Yaros is speaking in general terms and not specifically about Intermountain.
Our emergency departments, 24/7, and what you're describing, so anyone victim of violence, that's where they're brought.
He says more hospitals are creating private police forces to curb violence.
A lot of organizations still want to hold on to the past where hospitals were considered safe havens.
Yaros says while a bit of an inconvenience for some during the lockdown on Monday, the alternative could be worse.
If something happens here, they're going to be looking at you, Mr. CEO or Miss CEO, and say, why haven't you done anything to help secure your hospital?
Now, the statement from Intermountain Medical Center also said, quote, during this time, all patients in the hospital continued to receive care. We did need to reschedule some outpatient appointments due to the restricted access to the hospital campus, and we did go on ambulance divert for a short period of time. We are working with patients whose appointments were impacted and apologize for any inconvenience this caused them. You can read the full statement on KUTV.com. Heidi?